A non-governmental organization dedicated to supporting children with disabilities in partnership with local healthcare professionals have provided free medical services to the residents of the disability colony in KAROMAJIJI community in the Federal Capital Territory, FCT. Clearview's correspondent witnessed the event and now brings us details. It is no longer news that Nigerians are facing difficulties and have been subjected to untold hardship in recent times as a result of the rising inflation and exchange rate volatility, which has affected the purchasing power of businesses and consumers alike. For persons with disabilities in Nigeria who are already faced with multiple challenges, including widespread stigma, discrimination, and limited access to essential services, the situation is much more dire. In the heart of Abuja, the KAROMAJIJI Disability Colony is a vibrant community where resilience and hope shine bright. With a population of over 500 persons with disabilities, the KAROMAJIJI Disability Colony is home to hundreds of families, many of whom face barriers to accessing specialized medical care. The O.J. Jafia Foundation, in partnership with local healthcare professionals, have over the weekend bridged the gap by providing free healthcare for members of the KAROMAJIJI community in the FCT. The foundation's head of communications, Yechenu Deborah Tukura, and other partners speak on the mission behind the outreach.
As an organization whose mission is to provide support to children with disabilities, we aim to provide all the necessary support we can provide to children here, especially those ones with disabilities. We have medical items here, drugs. And then we have our health team who are taking their tests and seeing whatever their problem and challenges are before administering the drugs, the medicines.
We are here to support this great outreach, to support the people of KAROMAJIJI community with our health intervention, to educate them on mental health issues and how they can live in peace within the community.
One of the most common illnesses that we've seen here is just malaria, because the malaria and gastroenteritis, okay? So they are having fever, they are swollen, and these are simple things that can be actually solved, but because of lack of finances, they are not able to take care of their children. Well, the way forward is actually to do what we can do here by giving them the medications. Those that need antibiotics, we give them antibiotics. Those that need anti-malaria, we give them anti-malaria. And those that that have other advanced illnesses that need to go to hospital, we give them the proper referral to go to the hospital.
So this is 5 years after the transition period. Ideally, according to the Disability Act that was passed in 2018, it is expected that persons with disabilities have free and accessible healthcare services across all government hospitals. And aside that, when we say free and accessible services, when they get there, we have so many barriers. As such, more needs to be done in terms of having sign language interpreters and as well creating accessibility features such as elevators, ramps across governments and public and private health facilities.
Beneficiaries of the outreach, while lauding the initiative, called on the federal government to provide basic social amenities and infrastructure for the community.
We are close by to primary health care, but our challenge to the place is a road. People with wheelchair, like a woman with pregnancy on wheelchair, she cannot be able to push herself. So we need, if possible, to have an access road so that people will be reaching there without any prejudice. Our message to Nigerians is our children here, we have like 661. So we have out of school children. We need them to be part of those that will have education. So the serious challenge we face is we need those out of school children to have access to come to school so that they will not become some people that are bad to the society.
This health is more important because at times if you are sick here, for us to get car from this place to the hospital, it's not easy. To say government go fit do this kind of thing for us, it's come and look for, even though it's not hospital, like small place where we say if something is worrying us, go just take ourselves easily to that place.
The one-day gesture saw the provision of free medical checkups as well as distribution of drugs to members of the community.